Hello, my name is Tyler Smith. I'm the Director of Community Health here for the Lima market. I've been with Mercy Health for about 10 years, and I've been in this role specifically for about 5. Previous to my experience in this role, I was the well-being leader here for Mercy Health. The foundation is so supportive of all the work that we do for community health, specifically within the medical center, but also out in the community. So a couple years ago, we had a big need here within community health, and our department was continuing to grow. And through the System Foundation and our local foundation support, we were actually able to pilot a role here. But what's really cool about this is that it really allowed us to have more of a presence within our community, to build that trust and relationships, to really understand and identify barriers to care, and to take that back to the hospital, understand what programs we needed to build to truly have an impact on overall health. And so with that, in addition to our support with Ohio Northern University and their mobile clinic, we've been able to utilize their mobile clinic to go into these locations to provide primary care, preventative screenings, and just have that presence on site, but then also to do more wraparound health education and screenings at census tracts and opportunity zones where there are more at-risk populations. Through our ability and support through the foundation and to improve access, we've been able to host some large scale events within our communities, and specifically locations where these populations are at risk. And because of that, we've been able to bring those screenings and resources on site for those individuals who need it, that maybe didn't have a provider, maybe didn't have access, maybe have never had a preventative screening. And we truly have saved lives through the support of the foundation to make those events become a reality. In addition to all the other programs that foundation has had an integral role in helping support for community health, one of the very first programs that we had here was our Green Prescription Program. And so this came through a partnership with the West Ohio Food Bank, where it's actually in every single family medicine practice, in addition to 5 specialty practices within the medical center. And what we've been able to do is identify those patients that come in, screen them if they are food insecure, and actually provide them with a shelf-stable emergency food box that they can actually take when they're discharged and they leave their visit that day. In addition to that, we connect them to the food bank where they get a voucher. And what's important with this is that this is something through the foundation support. If we didn't have the support otherwise, this is something that we wouldn't be able to bring to fruition. And so this has been up and running for the last 4 or so years. And through the voucher with the food bank, they can connect them then to the food distribution, and the food bank can kind of help assist their needs long term as well.
Hi, I am Anisha Hale, serving as the gift officer for the foundation at Mercy Health St. Rita's. In my previous position as the coordinator for community health, we successfully collaborated with various organizations and schools to implement smoking and vaping education. This initiative led to the establishment of the Ambassador Program, aimed at empowering youth to support one another in abstaining from smoking and vaping. We successfully collaborated with the resident doctors via our graduate medical education program to provide a disease loan for educational purposes, illustrating to the youth the dangers associated with smoking and vaping. We successfully collaborated with the Bradfield Community Center to establish Giving Thanks the Mercy Way. This event occurs at the end of the year, providing an opportunity to identify specific tangible needs that can be addressed through the health needs assessment. During this gathering, our objective was to embody the principles of compassion and service by offering essential resources to individuals in need within the community. The resident physicians delivered essential health metrics and information on chronic health conditions. We additionally supplied food, winter coats, and hats. We extend our heartfelt gratitude to the donors of the Mercy Health Foundation for your unwavering belief in the mission of the Community Health Program. Guided by our very own Director, Tyler Smith, this role has truly illuminated the potential for meaningful change within the Lima community, a feat made possible solely through your generous contributions. Thank you.
Hi, I'm Matt Etzkorn, Vice President of Mission for Mercy Health Lima. I've been with her ministry for over 20 years. Over the years, I've served as a nurse in many different ways. I've also served as a chaplain for our ministry, and then gradually made my way into mission leadership through Director of Spiritual Health and now the Vice President of Mission. Some of those ways the foundation has been supportive has been through perinatal bereavement services, critical care conversations, palliative care, and anti-human trafficking. Sufficient Grace Ministries provides counseling services, spiritual care throughout the bereavement process. It starts even when families first find that there could be a potential loss, and then when a death occurs, they provide bereavement support in the acute care hospital and thereafter. High-quality spiritual care is so important to our mission here at Mercy Health St. Rita's and an entire region. Much of spiritual care is treating people as whole persons. And addressing their spiritual distress is so important, especially as they face some of the most difficult moments of their lives, and illness and sickness as they face their mortality and death. At St. Rita's, everyone plays a role in the art of medicine. Our chaplains at the bedside provide compassion, human touch, prayer. They allow people to know that God is not far away, and they embody God's love at the bedside. The same goes for our physicians and nurses who care from the heart. Your support of chaplain education, clinical pastoral education is so important to our mission.
Hello, my name is Reverend Cameron Hunt. I'm the Director of Spiritual Health here at St. Rita's Medical Center. So when it comes to our Catholic mission at St. Rita's Medical Center and Mercy Health, obviously a huge part of that is our identity and focus around spiritual health. And so being a part of this commitment to furthering education, providing the next generation of chaplains the opportunity to continue to receive the education that they need as they seek to care for the people who come to the doors of St. Rita's, it continues to be able to allow us greater opportunities both now and in the future to make sure that that mission is met, and that we are able to continue to provide the care that we are called to do within our Catholic ministry. From the bottom of my heart, I just want to be able to say thank you to all those who have given to these initiatives. I want to say just truly thank you for the blessings that you've been able to give to us. Chaplains are called to be in some of the most vulnerable moments of people's lives, to walk alongside those who are sick, who are hurting, who are maybe at the end of life, in whatever situation they may be. And we're called to be there in providing support, providing care, providing a prayer, a presence, whatever it may be. We're able to be there for that. And through these initiatives, your support allows us to be able to continue to be there, to be present, and to be able to care for those in need. So thank you for all that you do, and for all that you've given.
My name is Dr. Sunny Patel. I'm one of the interventional cardiologists here, and I've been working in Lima for about 7 to 8 years. And this foundation has done miraculous work for the cath lab and the staff, as well as the entire hospital and the system of cardiac care. From the LACP and the EMS response systems that they've divested funds into, to the cath lab itself, to the hybrid OR, and then to patient care after the procedure, including the wellness center and the cardiac rehab system that we have set in place. This is a total 24/7, 365, 360-degree holistic approach to the care of the cardiac patients in this town. And without the foundation, I don't think we would have been able to take each of these steps necessary to get to where we are today, where we're providing top-level care at a level that probably has not been seen in this area, and is now being witnessed all over the state, including and the country, in comparison to what we're providing for these patients. So without them, I think these patients would not have gotten what they've gotten so far, and I know that what they're doing so far for the future is only going to make it better. So thank you so much for everything you guys have done.
Hi, my name is Steve. I'm a paramedic and the field manager of operations over at LACP.
Hello, my name is Levi. I'm a paramedic over at LACP. We just wanted to express our thanks to you guys. You guys have been a real big help for our company. We do a lot of transportation, not only through the 911s here in the city of Lima, but to and from doctor's appointments via our wheelchair vans and our Mercy Express. And thanks to you guys, we have been able to keep our fleet operational in both the Mercy Express and the wheelchair vans. And thanks to you guys, we have also received an entirely brand new ambulance.
And we also recently received not one, but 2 Lucas devices. Lucas devices are automatic CPR devices that are life-saving pieces of equipment. Studies have shown that they provide better, higher quality CPR than any person could do. And not only do they provide better care for the patients, but they're also better for the crews who are performing the CPR. No longer do they have to stand up while the ambulance is rocking around. They can be seated safely while CPR is being performed. And recently, a member of our community was saved out walking around right now, thanks to the donors and the foundation and providing that Lucas device. As first responders in the communities, we never know what we're walking into when we arrive on scene. So from the bottom of our hearts, from everyone over at LACP, a big thank you to the foundation and all the donors for providing us with the best equipment and resources we need to provide the best care for our community.
Thank you very much.
Hi, I'm Stacy Schulte, the designated institutional official with graduate medical education.
And I'm Dr. Shadeh Javadi. I'm one of the emergency medicine residents.
So we knew that there was going to be some physician shortages in our area. And at Bon Secours Mercy Health, and with the Foundation's assistance, we were able to start additional residency programs in primary care to ensure that our families have the care that they need for the upcoming future. And we've been able to average about 40% of our residents staying within our community to be able to care for you and your families.
As an emergency medicine resident, in the short amount of time that we see our patients, we build a connection, and having those crucial critical care conversations are important. So we thank you for the training and education that you provided us.
So as we bring that training together, interdisciplinary care is important to ensure the whole patient is treated. So our nurses, our therapists, our pharmacists, our medical students, our residents, our physicians, and our social workers, our chaplains, there are so many people who come together to care for you as a patient. Behind the doors of the GME Center, that you helped prepare all of our teams to be able to do that very seamlessly. So from the bottom of my heart, I want to thank you for the donations that you've given, the prayers that you've shared to allow us to bring this program from start to fruition, in which we've been able to have residents successfully complete the program and some stay in the area. So from the bottom of our hearts, we thank you so much.
Thank you so much for your support and allowing us to train in such an eloquent and skillful facility.
On behalf of St. Rita's, we are so appreciative to the investments that you've made in us and our work. It's going to allow us to continue to care for our friends, our family, and our neighbors.